Hi, good afternoon, everyone. Thanks for taking a little time to spend with us. My name is Melissa Hensley, and I lead the Health and Human Services vertical for Google Public Sector. Today, we're going to talk a little bit about children's mental health. It's a huge issue. In the current system, for getting help can be difficult to navigate for families and caregivers. But there are heroes working to make things better. Today we meet one of these heroes, Dr. Dana Weiner. One of these heroes, she serves as the Senior Policy Fellow at Chapin Hall, and most importantly for our discussion today, the Chief Officer for Children's Behavioral Health Transformation in the Office of Illinois Governor J.B. Pritzker. With her expertise and dedication, Dana is a driving force behind efforts to create a more robust and supportive system for children's mental health. Please join me in welcoming Dr. Weiner.
Thank you. Thanks, Melissa. It's so exciting to be here with you today and talk about this challenge that we're facing in Illinois, and I think in many states across the country, and the way in which we're partnering with Google to address it. So I'm going to start my story back in 2022. So in 2022, our governor, J.B. Pritzker, in recognition of the fact that we're facing a youth mental health crisis, and mental health problems were on the rise among youth prior to the pandemic, but of course, the pandemic exacerbated those mental health problems by creating a lot of uncertainty for young people and stress and isolation. And that was compounded by a growing workforce shortage that made it hard to get to the services that people needed. So in recognition of these problems, our governor established the Children's Behavioral Health Transformation Initiative. And the goals of this initiative were, as you can see, to make sure that young people with significant mental health problems had the services they needed, and to provide transparency and clarity to their families in order to access those services. Now, this second point is important because one of the things that we were seeing, and one of the drivers, I think, of this whole initiative was that there were a group of kids, 55 kids, who were in hospitals for psychiatric reasons beyond medical necessity. And they were kids who were foster kids. They had come into the state child welfare system, experienced a psychiatric hospitalization, and they were stuck there, sometimes for months beyond when doctors said they could leave because there was no place for them to go. And actually, the director of our child welfare system was being held in contempt of court. But those 55 kids were the tippy tip of the iceberg of mental health problems. And the more we dug and looked at the data that we have lots of data in Illinois, we could see layers upon layers of kids in all of our child-serving systems that I'll tell you about in a minute that had mental health problems that weren't getting addressed. The problem with those 55 kids, though, is that some of them came into foster care because somebody thought they needed psychiatric services, and that's not what our foster care system is for. Our foster care system is for kids who've experienced abuse or neglect. And in states where we see kids coming into child welfare to get a psychiatric service, that's usually a symptom of a broken mental health service system. So, the way we got here today, this story actually started before 2022 because there were legislators and other people who were concerned about the voluntary relinquishment of parental rights in order to get psychiatric services. So way back in 2015, there was a law passed to try to make more services available to those kids. And really, and I've got some quick clicks here for some animation. What I wanted to show you here is that we have kind of an unprecedented convergence of legislative and executive branch support that allowed us to pull together the resources to drive the solution that we're now implementing. And I just use this slide to illustrate that, like, the governor announced the initiative. We had 10 months to develop a blueprint. I have props. It's right here if anybody wants to look at it. I also have some cards with the QR code for it. So we had 10 months to develop the blueprint. That involved analyzing data, canvassing the country for best practices, and testing some technology that Google is now building for us, which I'll tell you about. And then immediately after this blueprint was released, our governor, to my absolute incredulity, issued an executive order that everything in this blueprint was now law, that we were going to execute this whole plan. And in my 25 years as a researcher, who has provided data analytics support and program evaluation to public serving systems, I have never been in a position where someone turned to me and said, those recommendations you made, now make them all happen, which is amazing and slightly terrifying. Anyway, so we also started right away partnering with legislators to pass the laws that we would need for the legal foundation, the statutory foundation, to be able to make the changes that we're now pursuing. And so through this interplay of analytic work, legislative support, executive branch support, and advocacy, we've been able to go pretty far in a short period of time. So I mentioned that our system is complicated. It's complicated because, like some other states across the country, we don't have one mental health service system. We have a patchwork of programs and services that are delivered by 6 state agencies. Now, some states have it a little easier. In places like Tennessee or Washington, they have multiple child-serving agencies under one umbrella. It's a little easier to coordinate in those cases. But in Illinois, we have the Child Welfare Agency, which is DCFS. We have the Department of Human Services, which has divisions of mental health, developmental disabilities, and substance use prevention and recovery. We have the Department of Juvenile Justice that provides services to kids who've been involved with the courts. The Department of Public Health that oversees inpatient hospitalization. The Illinois State Board of Ed that has 852 school districts that all do their own thing, providing services to kids. And the state Medicaid agency, HFS. Each of these state agencies has an array of programs, but imagine what it's like if you're a parent and you need something for a kid. You don't know which of these places to go to. So my job was to figure out, how do we fix this, knitting a solution together across these agencies. And I spent a lot of time talking to people who work in these agencies, and probably most importantly, families. So what I heard when I talked to families is something that looks like this, that navigating the path, particularly to those intensive residential services, is like making your way through a dark, unmarked forest where what you get depends on which path you entered on, and you don't even really know what you're heading towards. It's kind of an undifferentiated, like, residential treatment, and it's kind of scary and dark. So what we're trying to do, and what we're going to do with Google's help, is to make it feel more like this. So when I say feel more like this, what I mean is no matter which pathway you enter on, you're greeted by a park ranger, a navigator to help you, and an information kiosk with maps to the system, and a clearly differentiated array of the types of things that kids need. This is how we want it to feel to families. But in order for it to feel this way, we actually have to rebuild it structurally from the inside so that it looks like this. And this, that thing in the middle, that centralized intake and referral, that's what we're collaborating with Google on. So early on, well, let me tell you about how we're going to do that. Because the part with Google is the first of 12 strategies that we're trying to pursue. 3 of them, so there's 3 categories of strategies. The first 4 have to do with centralizing and streamlining access, making it easier to get to the things that we already have in our system. The next 4 have to do with adjusting capacity, using data to understand where the gaps are, and literally geographically where the gaps are, so that we can build more service opportunities. And then the last 4 have to do with creating ways to intervene earlier, things like universal screening for mental health problems in schools and pediatric settings, and strengthening community networks. So these are our 12 strategies. The first strategy is something that early on, like in the first few months of doing this, we started to convene a group of representatives from all those 6 state agencies I showed you to try to get kids unstuck, to try to get those kids out of the hospital and figure out what services they were eligible for. And that was a really important exercise, although there were people who said to me, why are you doing this like micro-level casework? You're supposed to be looking at the whole system. I needed to understand what the barriers were firsthand, and I needed to see how those agencies work together. So what I did was, because I'm like an amateur tech development person on the side, is I developed a rudimentary version of a portal to let them talk to each other securely and privately, and to test ways of overcoming the legal and technological barriers to working together. Because I don't like to implement anything on a large scale without a test. Now, that test has generated data on 300 cases that we've staffed that way, and now we know it works. We know we can do it. So we came to Google and said, could we build something like this that actually is like built by professionals and not by me to make it work? So that tool is going to be called Beacon. And Beacon is going to be this centralized single place for families to go to understand what their kids are eligible for. Now, Beacon is not going to be an assessment tool. It's not going to screen kids. It's not going to provide a prescription for services. But what it will do is it will centralize all of that information so they have to only go to one place. It will give families the opportunity to upload their documents, because people with lived experience have said to us, we need to have a place to put the IEP, that's the Individualized Education Plan, a place to put the psychiatric assessment so that every time we get asked for it, we don't have to send it to someone else. So it'll provide that secure place. It will give them the opportunity to request a navigator to help guide them through the system, and it will continue to let this interagency group find services for young people. So I'm going to wrap it up by just highlighting the 4 key priorities that are driving this work. The first one is, well, I should start with the second one. The second one is to leverage technology to improve efficiency and transparency, because that's what we're all here interested in doing. The technology is making it possible to do number 1, which is pull all of that complexity back behind the state line. We don't need families to figure out which state program is going to fund their kids' services or where there are open beds. We can do that in a quicker way to free up the people to help people instead of having everybody spending so much time searching for things. The third priority is to elevate the voices of consumers. Every single thing we're doing is informed by parents and young people who've had experience trying to find services for mental health problems. And then the fourth one is continue to support, cajole, legislate, incentivize the state agencies to work together, to illustrate for them that they can accomplish more and give more access to young people for the services they're all trying to deliver. So I think I finished with 2 minutes to spare telling you the story of Illinois' challenge and solution. So
thank you for sharing.
Yeah.
Are there any questions for Dr. Weiner?